Welcome everyone to CBIA's HR Hotline Live webinar. I'm Diane Mokriski, HR and Employment Counsel here at CBIA. Today I'm joined by Vincent Farisello and Nick Zaino, both partners and attorneys at Carmody Torrance Sandak Hennessey, and both of whom are experts in the field of employment law. So today's what we call a live hotline. And so that means we're not going to focus on slides or pre-prepared material, but instead we'll answer your questions live as they come in. So please submit your questions through the Q&A, not the chat, and we'll respond to them one at a time. The focus of today's hotline is how to manage COVID in the workplace. We had really hoped we wouldn't still be talking about this 2 years later, but here we are. So today we're talking about anything COVID. So it can be issues like sick pay, whether you should give it, whether you have to give it, quarantining and isolation for your employees, how COVID illnesses are impacted by the new FMLA in Connecticut, Osha. So all those types of things having to do with COVID in the workplace. So if you have questions about that, submit those, and the three of us will do our best to answer them. So on that subject of COVID though, before we get started with the questions, I just wanted to remind everyone out there, CBIA members in particular, one of the benefits of CBIA membership is that members have the opportunity to participate in our policy councils. And one of those councils is the Labor and Employment Law Council. I know Nick is a member of that council. So this is a group of employment law attorneys, HR managers, business owners that are all interested in employment law issues. And we meet on generally a monthly basis. And I'm just bringing this to your attention because as it relates to COVID, at least, our meeting this month is in a couple of days. And our speaker at that meeting, we have two speakers, one of whom is Tanya Hughes, who's the executive director of the CHRO, and Robin Fox, who's an attorney at the CHRO. And they'll be talking to our group about COVID and what types of discrimination complaints the CHRO is getting that relate to COVID. As well, they're also going to talk to us about just how employers and employment attorneys should be conducting themselves at the CHRO, what's the best way to respond to complaints and how to kind of handle yourself the best way at the CHRO, at public hearings, mediations, just to make things go smoothly and effectively. So if you're a member of that council, you have the benefit of attending these meetings, hearing from these speakers, interacting with them and asking them questions. A lot of times our speakers are legislators and lobbyists, and so you really have an opportunity to let people know what the issues are that are important to you. So if you're interested in becoming a part of that council or any other council that CBIA has, let us know. And particularly for this particular council, you can email Molly Hammock, whose email will be in the chat. So let's get started with today's hotline. One of the most common questions I think we all get has to do with sick pay. And whether, over the past 2 years, there's been changing laws having to do with when an employer has to provide sick pay, whether they'll get a tax credit, things like that. And so I think, Nick, you were gonna touch on that. You wanna describe whether you're recommending that employers give sick pay and under what circumstances?
Yeah, so thank you, Diane, and hello, everyone. So in Connecticut, we do not have a statute or a law that specifically requires employers to provide COVID-related leave. There are some states like New York that do provide that employers have to provide COVID leave or sick time related to COVID. You would look to your own policy that you have, and that policy, of course, if you're subject to Connecticut sick leave law, should be compliant with the Connecticut sick leave law. But it is not required. You have discretion on whether to decide to provide any sort of days that are specifically related to COVID. And some reasons why you might choose to do that is to encourage employees not to come to work if they have any sort of symptoms of COVID or they've been exposed to COVID. You don't want an employee to feel pressured to come to work because they need a paycheck if you provide some limited COVID days. And certainly some reasons not to are that you feel you provide a significant amount of PTO already, a significant amount of sick time, and you're not looking to add to that bucket. So specifically with regard to sick leave for COVID, no, it is not required in Connecticut. You'd follow your policy.
All right, and so what are you, when you get questions from your clients saying, what do you think? I know it's not required, but is it something that I should give? Do you have an opinion on that?
Yeah, I mean, I generally would ask the employer what they provide for PTO, paid time off and sick leave, and whether the employer feels that there's an adequate amount of time that they currently provide. And, some employers have very generous policies and they don't feel the need to add additional time specifically related to COVID, especially as COVID cases, knock on wood, continue to go down. And so I'm not aware, frankly, of very many clients that have specifically added to their sick leave policies a certain amount of COVID days. I'm sure there are, but I have not, I can't think of anyone that comes to mind right off the top of my head.
Okay, so you're saying an employer does not have to distinguish between sick time for COVID issues. It can just be part of their regular sick time policy.
Exactly, yeah.
Okay, and so we have a question that's related to a similar issue, but they're calling COVID sick time for testing and quarantining. Before you get to testing, let's talk about quarantining. So is that the same? Let's say let's say they're either exposed or sick. Is that the rules the same? You can use your regular sick time?
Yeah, I think that again would just fall back on the employer's policy for what sick time is permitted to be used for. Treated no differently than any other sickness, whether it was an employee who's saying, my son or daughter or spouse has the flu and I'm not coming into work today. You'd look to your policy to determine whether or not the person can use sick time. So what I would probably encourage an employer to do is interpret the policy broadly in that case, not necessarily provide additional days to cover that, but interpret it broadly to allow the employee to use what they already have under the sick time policies for an exposure. And for testing, again, it's up to the employer. They can interpret that broadly too. If the employee is being tested because they think they've been exposed and they want to draw down on their sick time, I would probably encourage an employer to allow the employee to use it for that purpose, use their available sick time.
One thing, if I could chime in for a sec,
Yep.
For the employers out there who have 50 or more employees who may be covered under Connecticut's paid sick leave law, don't forget about that. If you are required to provide paid sick leave under that law, and you're talking about a quote unquote service worker, and the leave is not for the employee's own illness or quarantine, but to, you mentioned this, Nick, because they have to care for, say, a child or a spouse or someone who's in the household, that could be covered by that type of paid sick leave.
And so what do you guys think about, let's talk a little bit about testing, not just an individual employee who thinks they might have it, so they get tested, but if an employer has a policy that if you are unvaccinated, you must be tested regularly. Do you think, how do you recommend that an employer handle that? Should the employer pay for the tests and the time and all that?
Yeah, so this is a tricky little wage and hour question that we've all sort of been hoping to get guidance from the from the Federal Wage and Hour Division. And we had it for like 24 hours and then it went away, frankly. And the Federal Wage and Hour Division on January 20th actually issued a fact sheet that specifically addressed that question, Diane, as to whether or not an employer who requires that somebody either be tested or vaccinated, whether they have to pay for the time that it takes the employer to be tested. And they really issued that fact sheet as a result of the Osha ETS that was subsequently withdrawn by Osha. And so when Osha withdrew its ETS, the Federal Wage and Hour Division quickly withdrew its guidance. But what they had said under that guidance, and I still think it probably makes sense to follow that guidance, is that if the employer has a vax or test rule, in other words, you have to be vaccinated or get tested weekly, right? That sort of followed the federal ETS rule. What they said was for any employee who chooses to be tested instead of getting vaccinated, in other words, they could get vaccinated, but they've simply chosen not to and would be subject to being tested on a weekly basis, that the employer did not have to pay for the time that it took the employee to get tested. If the employee chose to get tested or was subject to testing because of a valid medical or religious exemption, then in that case, the employer would have to pay for the time spent by the employee in getting tested on a weekly basis. So they drew that sort of line in their standard that they ultimately withdrew, but I still think it provides reasonable guidance for employers.
Okay. All right, Vince, how about this one? We're a front-facing organization. Some of our folks are resistant to returning to the office, even though we've got all the COVID safety protocols in place. What are our options?
Well, I think this one really also comes down to, it's the employer's prerogative generally to determine where the work is going to be conducted. As a general proposition, I'm glad to hear the organization is following all of the recommended safety protocols. Good idea, keep doing that. And if as an employer you've determined it works better for your business, whether it be because of productivity issues or whatnot, you determine you want folks back in the office, that's within your prerogative to do. The caveat to that, of course, would be, and this is one that we've seen, come up time and time again, is when someone comes and says, it's not just that I don't want to come back, it's that my doctor is recommending that I don't come back, or there is some legitimate, I have some disability that puts me at risk, or you kind of fill in the blank. And when you're dealing with it as on an individual basis for an individual employee as a medical issue, well, that opens up the analysis under ADA, Connecticut's disability discrimination laws, about whether or not there's some obligation to provide an accommodation, and an accommodation could be allowing the person to work remotely. And remember, the accommodation needs to be reasonable. The limit is, as long as it doesn't provide, cause an undue hardship on the business, you generally would have to provide it. And in this case, by the sounds of it, it's implied that this employer has been having remote work for some time, perhaps the better part of 2 years. It's probably going to be a tough sell, a tough burden to meet, to show that you can't allow that individual to continue working from home, especially if it's been working. Maybe not ideally, but it's been working generally. I think that's, but you take the specific individual employee medical condition out, and employers should feel empowered, as long as they're doing all of the correct safety stuff, to determine if they want to have people come back.
Okay, so you're saying if, as long as an employee, we've got two types of situations. If you've got an employee who does not have a disability, but just really doesn't want to come back to the office because working from home has been super convenient, and they refuse to come back to the office, then the employer would be able to terminate that employee. Is that fair?
Yeah, I think the employer can. Whether that's a wise decision or not is a different question, yeah. But yeah, they can. Or the other one that I see come up sometimes too is, childcare stuff has changed, and so we're not talking about a medical issue. I just have a childcare issue, therefore I need to stay home, and so it begs the question: is that childcare situation, is that protected? On its own, perhaps it's not necessarily. It's not protected on its own. So I think that's more in the category of employer discretion. But I would say an employer would be wise to try to stay consistent with how they're doing that. You know, allowing one person to do it versus another. I'm always concerned about fairness issues, but you know, there isn't some specific explicit protection for plain old childcare.
Okay. Unlike a couple of years ago.
Right.
When the pandemic first started. Okay. How about this one? Should we remove from our handbook the new policy that we worked so hard on that's specifically related to the ETS? Now that the ETS has been withdrawn, should we take that out, or should we leave it in, or what should we do?
So it's you know, I think that's going to be something that's employer by employer kind of determination, but it's a good opportunity to just take a step back for a second, and I'll circle back to the original question, but let's just take stock of where we are right now. I think by now everybody knows that the Supreme Court had essentially blocked the ETS, remanded it back to the courts for further litigation, and then a week or two after that, Osha withdrew it anyway, essentially ending the litigation and killing it for now. But what they've also said is they're treating that withdrawn ETS as a proposal for a permanent standard, okay? And so unlike in an emergency temporary standard, they're going to undergo this process of notice, you know, taking comments, opportunity for hearing, and the standard for whether or not that'll happen is going to be a different standard than that grave danger standard that was necessary for an emergency temporary standard. But there may be something coming down the pike on this. I and lots of other people, you know, in the bar don't think that whatever permanent rule, if there is one that comes down, will be the same thing as the ETS. I think that's unlikely. That's because the Supreme Court had ruled that OSHA only has authority to issue workplace safety standards, not broad community health measures. And the Supreme Court basically telegraphed that what you were trying to do with the ETS was more of a broad community health measure. So where do I think this is going? I think there will wind up being some more general infectious disease permanent rule. I think it might have components of it that are similar to the ETS. It might not be specific to COVID. It may be more focused on specific things that employers have to do in the workplace. But also don't forget that in the absence of, you know, we're in a period now where there is no applicable rule other than OSHA's general duties clause. And so it's important to keep that in mind. The general duties clause is a general requirement that employers provide a workplace that's free from recognized hazards. And so perhaps enforcing at least CDC recommendations through, you know, the OSHA will be looking to what employers are doing. For example, are we following CDC stuff? They obviously can't penalize an employer for not following the old ETS rules, but they certainly can look to see what the employer is doing generally. And I think, you know, again, I'm going to circle back to the question of should we or shouldn't we, but Nick, I think, you know, feel free to chime in on a case that you just had dealing with OSHA in a non-ETS situation, but that was COVID related. So folks,
yeah, it's a current case. Yeah, I mean, it's a current case. And I do think it's important that employers continue to have a written program and written standards for dealing with COVID in the workplace. I think it's critical. OSHA's made it clear that they'll continue to enforce complaints under its general duty clause, and OSHA's made it clear that if you do follow the ETS standards, even though they're not technically in effect, that will be sufficient to meet the obligations under the general duty rule. All I can tell you is this is a client, it's a nonprofit, small employer, not in a high risk category from what I can tell. You know, small, less than 50 employees. Somebody filed a complaint with OSHA saying that they didn't think the employer had adequate preventative measures in place to prevent COVID in the workplace. OSHA issued a letter with 37 requests for information and documents. The employer provided reams of information, things like, was outdated, expired PPE utilized, was disposable PPE sanitized, decontaminated, were any administrative controls utilized in lieu of PPE, and it goes on and on, provide any written work rules, policies, procedures related to the employee's activities, provide all training records for employees, staff regarding PPE, all additional training records for the employees and staff, and it goes on and on. 37, the employer provided it and then got a request for 17 additional pieces of information and documents, including the names of current and former employees, because OSHA can conduct interviews. And so I think your policy on COVID can change as COVID changes, right? Your masking rules, your contact tracing rules, maybe that changes over time as the pandemic hopefully minimizes and hopefully dissipates eventually. But I do not think you should not have a program in place, whether it's in your handbook or a standalone policy or program. It's very important to not only meet OSHA obligations, but also to prevent, I think, the unlikely scenario that you are sued for not taking appropriate measures. And there is, I'll just segue to one other point because it's related. There is a case out of California that's caught some attention. It's not only, it's sort of called a take-home COVID case. And it was a case where an employee brought a wrongful death action against the employer, claiming that the employer did not provide adequate safeguards in the workplace to mitigate exposure to COVID. And the employee claimed that they contracted COVID, they went home, and their husband contracted COVID and died. And so the wrongful death action against the employer is on behalf of the employee's spouse. The employer tried to argue that for dismissal of the case under what's known as the workers' comp derivative claim theory, which is basically that claim is derived from the Workers' Comp Act, which of course prohibits individual causes of action, right? Workers' comp precludes, in most cases, any individual claim, and both the California Superior Court and the Appellate Court struck that down and is allowing the case to move forward. So even though it's difficult, very difficult for an individual to establish causation that they definitely got COVID in the workplace, nonetheless, this company is going to have to defend this case and really defend its actions to mitigate COVID in the workplace. So I do think it's important to continue to have those programs in place. Again, they can change over time, but you need to have protocols in place.
Going back to the original question, though, of whether you should continue. First of all, an employer is free, if they choose, to follow what was the ETS. An employer can choose to have a vaccine mandate. An employer can choose to have a vaccine or testing rule, or an employer can choose to have neither. And so, what's a good thing about doing it? Hey, it's great. It's one more step to try to prevent COVID in the workplace, trying to make sure your employees are as safe as possible. That also protects your customers, but you also have to have a read on the company culture. Very anecdotally, I have clients across the spectrum, across industries, and oftentimes when I'm talking to the leaders of those companies, it becomes kind of clear to me that there is some cultural for or against kind of especially on the issue of vaccines. Now, I'm not suggesting that the tail should wag the dog here, but you've got to look at what industry are you in, how closely are you, to what extent are you dealing with people, the public on a day-to-day basis. What's the physical workplace look like? There could be, based on how those factors change, I could see myself recommending, hey, I think it's a good idea to continue doing that if you can, and it's not too much administrative burden. I could also see situations certainly where it doesn't make a whole lot of sense, especially, the other thing that's changed in a post-Omicron environment is, certainly we all know that the vaccines are really effective for preventing severe illness and hospitalizations, but you keep hearing more and more about breakthrough cases. So there's some theories out there. There's some school of thought that the whole idea of mandating vaccines is already outdated. But one good place to start might be something you would have had to do under the ETS anyway, and that's trying to figure out what your population looks like. What is your vaccination rate? You can survey your employees and get a sense of, try to assess the risk that you have at your specific workplace.
Okay. How about the next one? This is also related to sick time, but this question is, seasonal employees don't have PTO or sick time. So what's the best practice if they test positive, and what's the ever evolving amount of days? So Molly, this is the point to put up that link to the CDC. If you have questions about quarantining and isolating, if you look at this website, it's the cdc.gov site, and it really kind of explains what the difference is between quarantining and isolating. If you, Molly, can you scroll down a little bit if you're able to do that? And so there's this chart, and it says, so if you actually test positive, if you're only exposed, but you're not testing positive, what you're doing is quarantining. But if you actually test positive, then what you're doing is isolating. And so there's different standards for how long you should quarantine and how long you should isolate, depending on lots of factors, whether you're up to date, whether you're vaccinated and boosted, which is what is considered up to date. So if you go down the chart, you'll see this is what you do if you're just quarantining, and this is what you do. It's 5 days at this point. This is what you do if you're isolating. And so you'll see the references to 5 days and 10 days, which is kind of confusing. We've got the CDC, it seems like their standards have changed over time as they've learned more about the virus. So everyone should, in my opinion, kind of have this site bookmarked. And you could even hand it out to your employees, just so people know in advance, especially those who don't have any PTO. You can let them know, listen, if you test positive, you're going to be isolating. That means you're going to be home, and you're not going to be working, and you're not going to be paid. Just so people know, which, by the way, is what, as an employer, that's what you want. You don't want someone who's positive to come into work and exposing everybody else and then getting everybody sick. So that's a helpful website. And Vince and Nick, do you have anything else to add to that?
I would just add in, you kind of already mentioned this, but the up-to-date thing, that does mean if, we all know, I think at this point, fully vaccinated means you got the primary dosage, the 2 shots under Pfizer, 2 shots Moderna, or 1 shot of J&J, and 2 weeks have passed. What up to date on COVID-19 vaccinations mean is if you are fully vaccinated and 5 months has elapsed since your full vaccination, and you're in a group that for whom it is recommended that you get boosted, and that would be most people, then in order to get by with not having to quarantine due to exposure, you have to have that booster. So if you're more than 5 months after full vaccination, but not boosted, you still may need to quarantine if you've been exposed. The other point I would make is whether we're talking about quarantine or self-isolation, depending on what the event was, whether it's onset of symptoms, whether it's exposure, or whether it's, based on an asymptomatic but positive test, note that day 1, when we're talking about 5 days, day 1 is the first full day after that event, not the day of, the day after.
Okay. All right, thanks, Molly. You can take that down. So let's talk, we've been talking a little bit about OSHA. Let's go into that a little further. Nick, I think you scared everybody to death with your your OSHA story. So what's the best way to determine if a COVID case is an OSHA recordable case if the employee doesn't know where they got it?
Yeah, that's a tough one. It's a really tough one because when you're in a pandemic and there's community-wide transmission, it's really hard to pinpoint exactly where someone got it. And OSHA, kind of has a wishy-washy kind of guidance on it, which is, hey, evaluate the employee's work duties and the environment in which they worked to decide whether there was some event or some exposure there that made the exposure at work more likely or not. That's really wishy-washy, and that doesn't really help someone too much. I kind of try to go back to whether there is some objective evidence, some objective basis to determine that it is work-related. And what do I mean by that? If someone is working and then if someone is working in your workplace and they got it, and a bunch of other people with whom they work also got it around that same time, well, gee, that starts to sound like that might have been related to the workplace. If, on the other hand, of course, take the opposite situation, nobody else at work has gotten it except that person, unless we have some other reason to think they got it there. Did they deal with a customer who might have been ill? Were they treating patients, or were they treating a population of folks that has a higher risk of it, maybe? Versus, again, no one else at work got it, but you wind up finding out that someone in the employee's household also has it. That certainly does not make me think that it's work related. But it's tough. So if it is work related, it is recordable, right, for OSHA 300 log reporting purposes. Nick and I were talking about this together when we were preparing for this today. And you kind of put it in a good way, Nick, when we talked. I think that you better be pretty sure if you're going to go put it on, if you're going to put it on your log, you better have a really good basis for doing it, because when you do that, you're essentially admitting that it happened at work, and that could have, other consequences. I don't know if you had more you wanted to add to that, Nick.
No, I totally agree. And as I mentioned before, I think one of the hardest things to prove with respect to COVID is causation. It is community spread. People do go to the grocery store. They do go pump gas. They do interact with family members. They do go to events, outside the workplace. And so I think the word of caution about concluding that it's work related is a valid one. And, there are cases where, it's more likely than not, based on objective evidence, like, that's the standard that OSHA wants you to follow, that it's work related. But I would press you to be careful about making that conclusion, or easily or flippantly putting on an OSHA 300 log that it is work related without doing a careful due diligence. And even if you do, I still think it's worth mentioning that, it does not mean that you have concluded that it is in fact work related, just that it might be work related based on the factors. Some kind of language in there that's qualifying, so that somebody doesn't take that, turn it around and say, well, that was work related, you admitted it, and so happened outside of work, I got it and then gave it to, like that case that I was telling you about, that California case, or it's workers' comp. So yes, you need to record it if it's more likely than not, after a reasonable diligence, that it's work related, but be careful about making that assessment.
Okay. How about this one? Do we have to require follow-up tests after an employee tests positive?
No.
My understanding is that that's actually counterintuitive. Yeah. You will test positive potentially for quite some time. So no, you should not require follow-up tests.
Nor is that on the chart that you put up,
right,
Diane. So
right. So the current rules for COVID sick time and quarantining in Connecticut. So Connecticut will follow the CDC rules. So again, just go to that website. Do either of you want to tackle this? What's an example of a generous PTO policy? I mean, that really depends on the company, but what do you guys think about that?
I've worked with clients who have unlimited PTO arrangements. That's probably the most generous I've seen, and that's certainly not the norm. That's more of the exception. And I tend to see that more in sort of like a professional services in professional services industries. So that's definitely an outlier. I don't think that is, yeah, I don't think that's certainly not the norm, but in terms of numbers, that's a tough.
Yeah, the one thing I would take into consideration in that analysis, now Connecticut does have paid FMLA. And so, employers might look to that as another source of pay for individuals that have an illness or a serious health condition. That's not to say that you should cut back or be more restrictive, but I do think that's a factor as well, right? There's now paid FMLA. And so Connecticut law would require for a full-time employee that they get about 5 days, right? 5 days of sick leave under Connecticut law, one hour for every 40 hours work, which comes out to about 5. So I don't know, anywhere between 5 and 10, I think, is just for pure sick days. A PTO policy envisions all of that being lumped together, sick, vacation, personal. So it really just so much depends on the employer.
You know what I think the answer to that question is, if you're in the audience, you should really contact my partner, Philip Montgomery, because he has information about trends in Connecticut. Like what are people paying? What are people giving for PTO? So he doesn't know yet that I just called him out there on that, but that's what I think you should do. He's the guy for that. Okay, I think we've already kind of touched on the next question having to do with people who don't want to return to the office. How about this one? If you do away with mandatory masking, but you ask everyone to come back, can people refuse? I think that means refuse to come back, but can you touch on if people refuse to wear a mask and if people refuse to come back to work, whichever, both of those situations?
So it looks like this one was, I'll tackle both, but I think this question was if we're going to get rid of mandatory masking and then also ask everyone to come back physically to the workplace, but some people refuse to come back to the workplace because of our decision on
Yeah,
that.
I think that's probably the question.
I think it's a similar response to the one I had before about, there's some employer discretion here, and there's no legal obligation to require masking at all times, and so it's within our discretion to have it be optional. And so an employee, requiring an employee to come back, absent the reasonable accommodation situation, I think the employer's within their rights to require the person to come back, notwithstanding the change in policy on masking. But I think the other question, a different version of the question would be, if we do continue mandatory masking and I have an employee who's refusing to do it, I think that could be a disciplinary issue. Same thing. We have the right to require that in our workplace, and we can choose to do that. Again, could be a caveat if, and there are legitimate situations where there is a medical reason why it may not be, why someone can't wear a mask all the time, and we could engage in that interactive process as part of the accommodation analysis, but absent that, within employers' discretion.
And masking at this point is city by city. Is that your understanding? Like Hartford just lifted theirs recently. What about Waterbury? Do you guys have a mask mandate?
No.
Okay, and I think I just heard Bridgeport still has one, if that's true. So people really need to just kind of look that up on their city or town website and just follow what individual municipalities are following. If an employer just wants to follow the law, that's where the law is going to come from. There's no statewide mandate anymore.
Yeah, what I would say on the, just to piggyback on what Vincent said, and I agree with everything, just as a practical matter for the employee who doesn't want to return to work, they're living home with an elderly parent, what I would suggest is that the employer communicate, probably in writing, with that employee, documenting some of the efforts that the employer is taking to provide a safe workplace. Like, just as a practical matter, do engage with that employee, ensure that you're taking every reasonable step to ensure that the workplace is safe, but you really do need that employee to come back to work because, what you'd like to do, an underlying premise on all those questions, can we force employees to come back? Is that you in fact do have a good program to prevent COVID from happening in the workplace. And so if you do get that OSHA complaint and there's 37 questions asked, you want to be able to produce some really good data to support the program that you have in place. So I do agree you have that right, but do make sure you have appropriate measures in the workplace based on your particular workplace.
Okay. This has to do with accommodations. So we provided accommodations, both medical and religious, to exempt employees regarding a mandatory vaccination policy. So maybe we were a little too accommodating last year. Can we go back and review those if we determine that we were a little too accommodating and now that things maybe aren't as serious? Can we change our mind?
Yeah, so the irony there is, yeah, you can always go back and reevaluate accommodations that you provided. Typically, it's when circumstances change. In other words, circumstances change where now you either, some facts have emerged that call into question the legitimacy of the accommodation, the original request. They said it was religious, and they've now said some things to coworkers that really undermine whether in fact it's religious, right? That would be changed circumstances where you can go back and revisit that. Maybe the changed circumstances is that, you now are, as a workplace, you now again are interacting more with customers, interfacing face-to-face, and you can't accommodate that anymore. There's just changed business circumstances that would make it an undue hardship for you to continue to provide that accommodation. But I think absent that, you can go back and just look at it, but it would be odd to change your mind without additional facts that warrant a change of your position on that accommodation. That's my thought on it.
I wonder if a scenario would come up where someone said that they were pretty medically compromised, and so getting COVID would be really super risky for them, and so that was the reason for the accommodation. And then let's say a couple months from now, hopefully, fingers crossed, numbers really go down. And the employer would say, you know what, it doesn't actually seem so risky anymore. What do you think about that? Would that be a reason to change an accommodation because the employer would be saying, yeah, I know that you're whatever, diabetic or whatever the issue is. I know you're immunocompromised, but COVID isn't really that, it's not as dangerous anymore. What do you think about that?
If I understand correctly, the employee is saying, I cannot be vaccinated because I have an immunocompromised condition or some condition that prevents me from being vaccinated. I don't think if it's COVID just generally is less prevalent in society, but I think if science came out and said, we're revisiting that, like the science has come out and said it doesn't impact individuals with this particular disability, they can in fact get vaccinated. Based on this new science that's come out, the employer can perhaps go back and say, can you check with your healthcare provider again as to whether or not you can be vaccinated? The science now indicates that it doesn't, your medical condition may not be a contradiction to getting vaccinated. I think that would be a changed circumstance.
The other thing I would say about that, Diane, is let's remember where we were in October, right? Numbers were, I think it was maybe September-ish, October-ish, the numbers were as low as they had been during the pandemic. And I think that kind of line of reasoning might have, no one would have thought that 2 months later, we would have had 30%, almost 30% positive test rate. So, I go by, in my mind, I think we're still in a pandemic. Whether it's 2% today, it could be 20% 2 weeks from now. So, I think let's keep it in perspective that until, we're not in a pandemic anymore, that, all of the stuff should continue being on the table.
Okay. So we've gotten a couple of questions about something I think you were talking about, Nick. So are you recommending that most employers have something in their handbook about infectious disease, just in general. Like everyone should have a written policy regarding how they're going to handle COVID or how they're going to handle infectious diseases in general.
Yeah, so I do think you should have something in writing. You should have a program in writing about how you handle COVID. I think I would wait unless you're, unless it's an issue or you have an existing policy about drafting a general infectious disease policy beyond COVID. I have a feeling we're going to get some guidance from Osha on that. Not that you can't, and we've certainly seen handbooks that have a very general statement about infectious diseases and the need to disclose that to the employer so that it can take risk mitigation measures to protect other employees. But I definitely think you should have a policy in place to address COVID. Whether it's in your handbook, which is more permanent, you now need to change your handbook, or it's a standalone program. Again, if OSHA comes to you and says, what's your program? Let me know, let me see how it's changed. What's your contact tracing protocol? What are you doing to ensure that it's a clean workplace? What are your quarantining rules? All that stuff. OSHA's going to have, if they get a complaint, they're going to ask you about it. And you're going to need to be able to provide some information. And should anyway. I mean, it should be part of the, part of what you do as a good employer. A lot of the surveys out there indicate that employees do want their employers to either require or strongly encourage employees to get vaccinated. Like, employees still very much want their employers to have a program that provides a safe workplace. So I think it's important not only for legal compliance, but also it's the right thing to do and necessary in order to ensure that you have a comfortable workplace.
One thing I'll just add to that regarding this specific question from Jennifer, she's saying, for example, if the community or hospital numbers increase, we as the business have a right to enforce a mask policy. And so she's saying, should we put that in our handbook? And I would just say to that, employers should remember that you don't have to have it in your handbook in order for it to be true. So you don't have to have every rule in your handbook. You can, as the employer, say to yourself, hey, if the numbers get really high, we're going to enforce a mask mandate. And simply because it's not in your handbook doesn't mean that you can't enforce it. And so, like when Nick was saying, putting it in a handbook is kind of permanent, and it's kind of a pain in the neck to have to keep revising your handbook, right? And then you lose track of your revisions and the whole thing. So if you have a handbook policy, your handbook policies are for the policies that you can really envision being, generally speaking, these are the rules, and these are also going to be the rules a couple years from now. Then as your needs change, and you can enforce policies, and they don't necessarily have to be in writing. So I think it's just important that people remember that. Okay, how about this one? I'm going down to the one from 1:22 p.m. How does the withdrawing of the ETS affect OSHA record keeping going forward? If an employee contracts COVID from a coworker, we really kind of already touched on that. Must it be recorded on the OSHA log? Can the time missed become a workers' comp claim? What do you think? I feel like we already kind of touched on all of that.
Yeah, I would just say that the withdrawal, I would just reiterate, the withdrawal of the ETS doesn't mean, that didn't impact an employer's obligation to record work-related COVID cases. Okay, so that's still the case. If this question assumes the truth that someone got it from someone else at work, then I think that's likely something that's going to be something that goes on the log. Can that time missed become a workers' comp claim? It's a similar question. It depends on the extent to which it can be proven that it was that it arose out of the workplace and out of work. If we assume, like the question does, that yes, it did arise, it did happen at work, then it could very well, it could potentially be covered by workers' comp, depending on how serious the injury, the illness is. Let's not forget, this comes up in the paid FML context as well. COVID is a scary disease for lots of people who get it. a lot of, fortunately, I mean, obviously I'm not immune to the fact that there's been some very serious illness and lots of deaths, but also lots of people, it's not unlike getting the flu or a really bad viral kind of infection. And so a lot of times, whether it's in the paid FML context or a workers' comp context, it depends on the severity of the case for the person too.
Yeah, so in case of addressing this question about withdrawing the ETS, if everyone can just remember, the ETS really had to do with mandatory vaccination policies and testing. And that was withdrawn. That's no longer the case. You don't have to have a vaccination policy or a vax and test policy. The Osha rule, though, still applies that you record and report work-related illnesses and injuries. So they're kind of two separate things. The next question, when does the ETS expire? The ETS no longer exists, right? So the answer is it already didn't really expire. It was withdrawn. So it is no longer a thing. So employers don't need to worry about that for now. As Vince mentioned earlier, there may be something coming later, entirely new, more permanent, an effort at a more permanent rule, but we'll just have to see if that happens. I'm going to go to a question from Don, and I think, Nick, you may have been talking about, I can't remember which one of you was talking about sick pay, Connecticut sick pay. Are the 5 sick days in Connecticut mandatory or suggested?
Right, so just remember the sick leave, Connecticut sick leave law applies if you have 50 employees. It excludes manufacturers and it requires employers to provide 1 hour of paid sick leave for every 40 hours worked by a quote service worker, right? So, the 1 hour, I think if you just run the math, it's going to be about 5 days, but it's really 1 hour for every 40 hours worked if you are subject to the sick leave law in Connecticut. So.
Okay. Let's move to Connecticut FMLA just for a minute because you guys did reference that briefly. If a person at work gets COVID, is that going to be covered by the new Connecticut paid FMLA statute?
Well, just like the fact that not all illnesses qualify for FMLA leave and/or paid FMLA benefits, similar with COVID cases, the answer will depend on the severity of the illness and whether that makes the employee have what's called a serious health condition. That's kind of a legal term of art. What does that mean? Serious health condition in the context of an illness is one that causes incapacity from the ability to work if one, the patient has to undergo inpatient care to deal with that illness, or two, if they have to have continuing treatment by a healthcare provider. And that could include, 3 or more days out of work, but plus medical treatment. It could include, if they're required, to the extent there's any continuing treatment, it could possibly be covered. If it becomes chronic over time and continues to require treatment, like say long COVID, in those cases, it could possibly be covered, but probably the majority of cases, like for example, I'll use myself as an example, when I had COVID, I went for a test somewhere, but aside from that, I didn't have any real continuing treatment with a healthcare provider. Fortunately, I had a mild case. I spoke with my healthcare provider on the phone, who just told me to, stay home, rest, quarantine, told me all the stuff to do, drink plenty of fluids, whatever, watch the fevers. And I just kind of recuperated at home. For back then, it was a 10-day period. If in a case like mine, that likely would not be covered not be covered as an FMLA leave. On the other hand, I wind up in the hospital, or it's severe enough that I have to go to multiple doctor's appointments, or I have to get some kind of additional treatment, something out of the ordinary, that very well could be covered. the key will be, and this is why this is why the law allows employers to require employees who are seeking FMLA benefits to complete a medical certification form. That's sort of, if there's a question out there about it, the med cert form will likely carry the day.
All right, so, and if anyone has questions about paid FMLA and COVID, if you go to ctpaidleave.org, that's the website for the Paid Leave Authority. And if you go to that site, right at the top, it says, if you're about to file a claim for paid leave because you have COVID, click here first. And so you can click there and you'll kind of see a summary of what Vince just said. It is, like, generally speaking, it's the fact that you have COVID is no different from any other situation. You have to have a serious health condition, or if you're looking for caregiver leave, the person you're caring for has to have a serious health condition. So it's really just a matter of whether your experience with COVID is a serious health condition. All right, how about this one from 141? Are we treating individuals fairly with regards to masking if we continue to require unvaccinated individuals who have tested positive and recovered to continue to wear a mask? We lifted masking requirements for those who are fully vaccinated, but not the unvaccinated, regardless of contraction. Some individuals who were unvaccinated and tested positive felt they were being treated unfairly, although they claimed they have natural antibodies.
Yeah, people are going to feel whenever there's a rule like that, some people are going to feel that it's unfair. Is it illegal? I don't think so. Probably not. If I have to try to find a situation where there might be a legal issue, suppose we could talk if someone couldn't get vaccinated due to a medical or religious reason, but we wouldn't be applying the rule just to them. We'd be applying it to anyone who's unvaccinated. So even in that case, I don't think it's much of a legal issue, but
yeah,
it's an employee morale kind of issue,
yeah.
But so be it.
Yeah, I think, do you guys agree there's really not, it's not like vaccination status is a protected class, right? So like race and religion and gender. So you can treat unvaccinated people differently to some extent, as long as a disability isn't at issue. I think what I would do is, in this situation, maybe refer back to that CDC link, because I think that link also provides guidance on masking, if I remember correctly. And so if an employer really wants to have something neutral, a neutral policy that they can apply to all their employees, you can kind of refer to this CDC guidance that says, hey, listen, if you're I'm pretty sure it says if you're unvaccinated, it's a good idea to wear a mask. And so you can always point to that. And I think there's also a mask guidance for when you're coming out of isolation as well. So if you're looking, I think I agree with Vince, it's not like you're going to be breaking the law if you do that, but I do think you're going to have a morale issue potentially, unless you can point to something really neutral, like the CDC guidance.
Right. The real key is whether or not you have the antibodies due to exposure makes you more likely to spread it. Because part of the reason for masking is not only to protect the individual, but to prevent the spread of it. So is there a distinction between being vaccinated and being unvaccinated, but getting COVID and having those antibodies? And I'm not sure the science is clear on that. I do know Walmart just announced yesterday, I think, that their policy is that if you're unvaccinated, you got to wear a mask. If you're vaccinated, you don't have to wear a mask. And I think it's just that black and white, but I do think the employer has discretion.
All right, let's, I think we've got time for maybe one more. I'll just address this. There's one question that says, which chart indicates that you should not conduct follow-up testing? I don't think that's on the chart I was talking about. That's just, I think you can probably find that information on the CDC website, maybe not the specific site that Molly put up, but if you go to the CDC website, there's information about how once you test positive, you will likely test positive for quite some time. And so you don't necessarily want to require your employees to have a negative test in order to come back.
I would just add to that quickly, Diane, that it was a long time ago that CDC took the position that they were not recommending a test-based strategy for exiting quarantine or isolation, that it has been a symptom-based one for some time.
And so, Nick, I'm going to throw the last question to you. I think you touched on this, but if you can just maybe throw a little emphasis on this. I'm going to the question from 143 at the end. Are we required to pay for the time off it takes to conduct testing? Are we required to pay for weekly tests? And so what is
Right.
your that?
Right. So if you follow the DOL guidance that came out, the one that I said it was out for 24 hours and they withdrew it, the DOL said that if you require employees to either be vaccinated or be tested, so it's an employer requirement, and the employee simply voluntarily chooses the testing over the vax, not because they have a religious or medical exemption, but just that they prefer to be tested rather than get vaccinated, then you don't need to pay for it. If, however, the employee is unable to meet your vaccination requirement because of a valid medical or religious exemption, the DOL said in that circumstance, the employer should pay for the testing because you've imposed it. It's not because the employee chose to do it, so you should pay for the time involved in the employee getting tested. And that's testing outside of the workplace, also in the workplace. And so it would all be compensable.
All right, so that rule was withdrawn though.
That was withdrawn. So again, it's not, we're back into that fuzzy area as to what is integral and indispensable. That's the standard for when preliminary, post-preliminary work, things that aren't necessarily tied to job duties as to when they're compensable. So it's just not a clear standard. You know, if it's integral and indispensable for the employee to get COVID tested to do their job, like it would be for a healthcare worker, then no question, you have to pay for that time that it takes to get tested. But if you're talking about an office person who doesn't interact a lot with the public, is that testing integral and indispensable? You know, maybe not, in which case it's not compensable. But if you're looking for a guide or a safe place or a safe standard, you know, following that DOL guidance that had come out when the ETS was effective is a pretty good way to go.
Okay, good advice. All right, so that brings our 1 hour lunchtime hotline to a close. I know people still have some questions, but I guess what I would do is for a lot of these questions are either CDC related or Osha related, and both have pretty helpful websites. I'd refer people there. You can also go to the Carmody Torrance website and the CBIA website for more information about these issues. Thank you, Vince and Nick, for your participation. We'll see you next time. And everyone else, we'll see you next time, and have a great rest of the day.
Thanks, Diane. Thanks, everyone.
Bye-bye.
Bye.
Bye-bye.